Hi, everybody. Welcome. My name is Kate Shingler. I'm the Director of Marketing and Communications at Brain Canada, and it is my pleasure to be your moderator for today's conversation, how exercise boosts brain health, whether you live with dementia or not. This talk is presented by the Alzheimer Society of Canada in partnership with Brain Canada. You can find out more about both of our organizations in the chat. Before I welcome our panelists, here are a few housekeeping notes. This session is being offered in English et en français. To select a language, you can click on the interpretation button at the bottom of your screen and then choose your preferred language. Vous pouvez cliquer sur le bouton en bas de votre écran et choisir votre langue préférée. You will also notice that poll questions will occasionally pop up on your screen throughout the session. Please do answer them. This helps us understand if we're meeting your needs, so we really appreciate your feedback. This talk is being recorded and will be made available on the Alzheimer Society website and YouTube channel later this week. Finally, this is a conversation. The chat is open and is being moderated for audience conversation and sharing. If you have questions for our panel, please send them through the Q&A feature on your Zoom. That's the question and answer, the Q&A. We'll do our best to answer all of the questions today, but any that are not covered in our hour together will be addressed by email in the days to come. So please do provide your contact information with your question if you would like follow-up. I would like to acknowledge that the offices of Brain Canada Foundation are located on the traditional ancestral unceded territory of the Ganakahaga peoples, a place which has long served as a site of meeting and exchange among nations. We honor and pay respect to elders past, present, and emerging, and we dedicate ourselves to moving forward in the spirit of partnership, collaboration, and reconciliation. In our work, we focus our efforts on the Truth and Reconciliation Commission's calls to action, numbers 19 to 24, that pertain to improving health for Indigenous peoples, and on number 57 that focuses on advancing our own learning of Indigenous issues. Our team is sharing links to the calls to action in the chat right now, and we encourage you to take a look at them. Now it is my pleasure to introduce the panelists who are joining this conversation today, all of whom provide different and fascinating perspectives on today's topic. So first, let me welcome Bill Heibein, who was diagnosed with young onset Alzheimer's disease 24 years ago at the age of 59. He is a co-founder of the Ontario Dementia Advisory Group and a strong advocate for people living with dementia. He credits physical activity as one of the reasons his quality of life has been so good for so long. Hi, Bill. Next, I have Jane Sandercock. Jane was a caregiver to her father, and she is a health services and policy researcher. Jane found that exercise was critical for her dad on his journey with dementia. Meet Faye Wyma, who has been a caregiver for her mother and who's also a designer and design instructor. For Faye, physical activity is really important to her own caregiving capacity and stress management. We also have some researchers here with us. Dr. Cindy Barha from the University of Calgary, who has studied how tailored exercise recommendations can improve brain health at different ages and stages. And finally, last but not least, we welcome Dr. Laura Middleton of the University of Waterloo, whose brain and body lab has studied dementia-inclusive exercises and its positive impacts, including collaborations with folks like Bill. So thank you so much for joining us. Welcome to all of you. My first question is going to be for you, Bill. Can you tell us a little bit about your journey with dementia and how did your life change when you received the diagnosis?
I guess the year before I actually received the diagnosis, I was noticing things at the office that were just weren't quite right, shall we say. My wife pushed me to be tested. I had all of the testing done in 1999, and I received an official diagnosis January of 2000. At that time, I was a partner with Ernst & Young, but in addition, my wife and I owned and operated Amethyst Farms, under which name we have bred, trained, and shown registered quarter horses for years. At the time I received the diagnosis, I was also eligible for early retirement. So I thought, since they'd given me maybe 5 years of useful living, I thought, okay, I'll take immediate early retirement, retire back to the farm, and I'll enjoy myself for as long as I can. Well, at the end of 8 years, they again ran me through every test in the book, and this time said, well, you've gotten 8 years. We doubt if you will see 3 more years, at which point you will probably end up somewhere in a home. Approximately 5-6 years ago, I was again run through every test in the book, all the CT scans, everything. This time I was told, we don't know what you're doing, just don't stop. And what I attribute it to is the physical lifestyle. I believe it's 150 hours or something. I can't remember the exact number that you're supposed to put in a week. No, maybe it's 15. I can't remember exactly. But anyway, I put in 3 to 4 hours physical activity, strenuous physical activity daily. Now, this time of year is haying season. Haying season, whole different ballgame. 10 to 12 hours, you could be throwing hay bales in the field. So I think it's the strenuous physical activity, and I think it's the amount of time I spend outdoors in the bush with animals, etc., that has kept me going to the point where I am now. Plus all of the social activities I've become involved in.
Thank you. Very inspiring. Laura, you've been partnering with Bill and others with lived experience as a researcher for years now. What do you think more people in Canada should know about exercise, brain health, and dementia?
That's a hard question. When we're thinking directly about dementia, I would say that people are increasingly recommended to exercise by physicians, but they're often sent home to do it on their own. And that's not reasonable for everyone, especially if they're not like Bill. They haven't been physically active before. So developing supports and including dementia in community programs and services is really important. You know, exercise is a key part of clinical guidelines for the management of dementia. This has the strongest evidence. So it's really important that we create opportunities to support people living with dementia.
Jane, how about you? Can you share a little bit, when you hear Bill's story, it must make you think as well of your dad. Can you share a little bit about what exercise meant for your father on his journey?
Yes, for sure. What Bill and Dr. Middleton have just said really resonates for me, actually. My father was a very physically active man his entire life, and loved playing sports and being outside and so on. And certainly I feel like it made a pivotal difference in his journey with dementia. And what I found actually was similar to what you're describing, Bill. His mobility, his mood, his energy, everything got much better the more active that he was. And we're not talking having to go out and work out in a gym. That wasn't the way he preferred to be active. He just liked to be outside and walking, or at the driving range, going to a golf course. But what became a real issue was access to those sorts of activities as his disease progressed, and he needed more support. So really can really relate to what you're saying, Dr. Middleton. Very true.
Thanks, Jane. Faye, when we're talking and thinking about exercise and physical activity and its benefits for people living with dementia, we want to open up the conversation to include caregivers of people living with dementia. What has exercise and physical activity meant for you, and what role do you think it's played and how you've been able to cope?
I started my caregiving journey completely naive, and it was a little unexpected. My father had been caring for my mom, and when he passed away, suddenly I was the caregiver, and I was not ready for it. So you go through so many years of caregiving, and you start to feel burnt out. There's the fatigue, the burnout. I think 1 in 3 caregivers does experience depression, and I was feeling all of it because I didn't seek out the resources. When I was able to integrate some physical activity into my own lifestyle, that became even it wasn't just about the physical strength that I was trying to regain, but it also became, I realized that I was feeling better mentally, and it gave me some structure. And what Laura has mentioned about resources, I feel like sometimes we're thrown into a situation where we're trying to figure it out on our by ourselves, and we need those happy hormones as caregivers when it comes to caregiving, and making sure we're at our best to provide that support for our loved one.
Faye, did you receive some suggestions about how you can take care of yourself as a caregiver when you started to take over the responsibility for the care for your mom? What was that like?
It was, as a caregiver, especially one in the sandwich generation where you're caring for children as well as a parent, it's so hard to find that balance. And I think I personally left it too long, and it wasn't until I had hit a wall that I started saying, hey, I've got to take care of myself because I'm not taking care of anybody very well. So it was quite difficult. I started to look for different activities. I found one that I loved, which is aerial. It's both physical and it is mental as well, because it's a puzzle when you're trying to climb and do some of the sequences. So I feel like I didn't seek out resources early enough because I felt I was too busy.
Cindy, I think when you hear Faye's perspective and that notion of not seeking out resources early enough or having some regret, I imagine that is not unusual for any of us to think we might have gone back and done something a bit differently. But in your role, what do you think Canadians need to know or better understand about physical activity and our brain health?
Well, I think everyone's made some really interesting points and important points. I guess for me, it's almost as a researcher, why is exercise actually beneficial for your brain? We all know that it's good for your body, it's good for your your lungs and your muscles and your waistline. But I always want to share the information as to why it could be helping your brain. And so we know regular exercise leads to sharper thinking and better memory. And reasons why that might be happening is because exercise can help sort of stop shrinkage of important parts of the brain that we know you need for learning and memory, particularly as you get older. And it can even actually sort of help increase the size of those brain parts and create new brain cells in important parts. It can help increase the size of older cells that have been there for a long time. And one way that physical activity is doing that is by increasing this I think of it as an amazing substance in your brain called brain-derived neurotrophic factor, or BDNF. And so I think of that as a vitamin for our brains. And it's sort of what we need to keep our brains healthy. And exercise is actually an amazing way of kind of increasing BDNF levels. And also, I think another thing I would love everyone to know is that it's never too late to start exercising. So, even if you've been physically inactive for most of your life, starting any sort of exercise routine, in your 50s, 60s, 70s, it's going to be good for your brain. And it's important to know that you don't need to be a ultra marathon runner or a pro athlete. Even 10 minutes a day of brisk walking is going to be good for you. And I think that there's a lot of opportunity to be creative with your physical activity. So this was kind of mentioned by Bill too. So things like gardening, vacuuming your rugs, walking up the stairs, going for outside with your grandkids, your nephews and nieces. Those are really great ways that you can increase your physical activity levels. And we know they're going to be good for your brain later on as well.
Sometimes when we hear we need to exercise a certain number of minutes at a certain level per week, it can be daunting and we can feel discouraged. So sounds like those are helpful ways that we can think about incorporating it and not feel intimidated. Laura, maybe I'll turn it over to you with that question, because I imagine you deal with this often too when you talk to your patients about how can I fit in exercise, what kind of exercise. Some may have mobility challenges.
Yeah, and we talk about that a lot, and I would echo what Cindy says, is that, the exercise recommendations have some specifics, but our understanding of the specific dose so far is is not great. As Bill alluded to, the 150 minutes per week is something we generally refer to, with a couple times of strength training. But I would say that the most important thing is that you're active, more than the specifics of, whether you're on a treadmill, you're walking outside. So finding something that you enjoy, and I would argue doing it with someone whose company you enjoy, is one of the best ways to be active, because we know social support is really one of the primary determinants of being active. So, going for a walk, which I think Jane talked about, is often one of the most meaningful activities for people. Going for a walk outdoors with someone whose company you enjoy, which can include a pet. But also, dancing with a loved one, grandchildren, gardening, as Cindy said, all these things are meaningful. So you can go to a gym, and that can be a great support program, but it doesn't have to be. I can give you all sorts of things you can just do at home as well if you want, if there's purposeful exercises as well.
Mm-hmm. And your point about doing it with somebody whose company you enjoy or a beloved pet is a point well taken. We're probably more likely to keep walking if we can walk with our dogs or our neighbor who we enjoy chatting with. Bill's dog may make an appearance on the session today. Laura, can you just let us know, before we move on back to Bill, what in your research lately has surprised you? Is there something that has really stuck out and surprised you that you would like to share with us?
Well, that's a good question. And I know we've talked about this recently. What I last said, I think some of I guess one of the things that stood out is we have early in the pandemic in 2020, we co-developed an exercise and well-being program with Bill on the team, as well as other people with dementia care providers and healthcare professionals. And we've been piloting the program both in person and online. And one of the things that really stood out to me is the broad impact exercise can have, in that when we measured changes, and there's improvements in strength and function and quality of life. But one of the things that really stood out was people's perspective of dementia changed when we interviewed them. They had hope for living well as well as they can, both care partners and people with dementia, in cases where they had really resigned themselves just to decline, that they felt empowered, that there were things that they could do to impact how well they lived day to day. And now that they were going to do as much as possible to live well one day at a time. And I think those changes in empowerment that we often don't capture in clinical trials are so essential to living with dementia, and carry over outside of the exercise program, right? They impact your everyday lives.
Mm-hmm. Bill, is there anything that you can add about what has surprised you? I mean, you're a success story, I think. And when you think back to what you shared with us, the kinds of feedback you were getting from your medical team more than 2 decades ago, I guess everybody thinks, okay, Bill knows something that we should all start to consider as well. Like what for you has been kind of surprising about this?
I think one of the things was, and I think I'd mentioned maybe once before when I was talking to you, Kate, was that for almost the past 50 years, I had been bass player for a small Dixieland jazz group called Bottom of the Barrel. And our piano player was a medical doctor. And when I was first diagnosed and mentioned to the band about this diagnosis, one of the first things he told me was, don't believe everything that a doctor tells you. And coming from a doctor, I thought, okay, I will try and prolong the 5-year periods that they're working with here. I would think that's one of the things is sort of go your own way in many respects. I guess the thing that's come more to me recently is I've been reading research where increased heartbeat, increasing the blood flow to the brain, etc. There's been research being done where apparently there's amazing things that they're discovering. I was told that the brain cell that dies as a result, well, through dementia, whatever, the brain cell that dies, yeah, the cell itself is gone, but with increased blood flow, the cells surrounding that cell can start to crossfire and reprogram themselves. So just because you've got a problem in one particular item, if you keep the blood flow, you keep the exercise components, et cetera, keep active and keep social. I think all this will tend to get you over some of the original hump, shall we say. Again, when I was first diagnosed and given this diagnosis, I had 11 horses in the barn, 3 of my mares were due to foal in a 3-month period. And I literally, although apparently my wife says I went into deep depression, I had no time to sit there and feel sorry for myself. And I think horses in many respects saved me because as I say, I had no time to sit back and just do nothing. I had to get physically active, and I stayed physically active because of what I do on the farm.
Jane, tell us a little bit about your father's experience, because you'd shared with me that you think he might have been more active if he'd had the right supports in different settings and maybe different outcomes too, or a prolonged period of a better quality of life.
Yeah.
What does this bring to mind for you?
Well, I think I was a bit surprised. I shouldn't have been, but I was a bit surprised by the barriers that began to impact our ability to allow him to remain active. And he lived in a different community than me, so I was sort of caregiving at a distance with him. And so at the point at which he moved into a retirement home, that decision was made for social reasons. Actually, he wanted to live with other people. He was getting lonely. And so that made sense. But that shift really shifted him to a far less active lifestyle, and things we didn't anticipate, that the lack of stairs in a retirement home. Now all of a sudden, instead of doing, he was living in a split level home, so he was doing stairs up and down all day, looking after a big property, so he was outside being physically active all day, in addition to his recreational pursuits. Then he moves into this place where he doesn't do any of that. And the home that he was living in did offer a wide range of activities, but none of them were very physically demanding. And so I pushed repeatedly to try and get them to use local facilities. They had a beautiful walking track. Why not do a daily walking club? And they were open to some of those ideas, but there wasn't the support for it. There wasn't people to help. So we ended up having to fund ourselves. My brothers and I, we drove down, so it was out of our pockets, of course, and time and energy to keep my dad active. But then we started paying other people to walk with him and to take him out and to do things too. So a real barrier is economics, obviously. If you don't have those kinds of resources, you're not going to be able to keep as active as you need to be. And so, yeah, that was the long and short of it for me. It shouldn't have been surprising, but it was really shocking to me how many just restrictions there were in terms of us going into places to help him to participate in activities too. There didn't seem to be a lot of openness toward that.
And
so
this was pre-pandemic, Jane.
This was pre-pandemic.
Right?
Pandemic
is a
whole other bag of, pandemic really was, as we know, the costs were borne on the backs of people with dementia, who are living in congregated facilities where they couldn't do anything. They couldn't go out. They couldn't go get exercise. It was not great.
Thanks for sharing that, Jane. Bill, I see that Bill has something he'd like to add, so we'd love to hear from you, Bill. And just unmute if you could, Bill.
Just in
Perfect.
addition to what Jane was saying there, a lot of the problems, I think, with many people, when you receive a diagnosis from the doctors, basically, you're given the diagnosis, you're told to go home, get your affairs in order, be sure your will's up to date. The assumption is immediately made that you can't do these things. You shouldn't be doing stairs. You shouldn't be taking long walks in the bush. And I think that a lot of that has to do with basically what you're told by the medical people at the time.
Yes. I think I shared with you, Bill, that my dad, who's 86, the last time he renewed his passport, he took the longest possible period he could, 10 years. And I think the attendant said, "Are you sure? Do you really want to renew it for 10 years? Imagine that." But yes, he did. And I think that there's something to that kind of really forward-looking approach. Cindy, can you weigh in and let us know what you think, what you're hearing, and share if there are things that have surprised you about your research and exercise and the brain?
Well, I think as a neuroscientist that's moved into this field of exercise and brain health, every day something surprises me, some new finding. Laura's work every day, I'm like, oh, that's really interesting. That's really cool. But I think one of the more recent things, and it kind of touches upon what a lot of people have said, is this whole idea of the indoor exercise and outdoor exercise. And so I was reading this paper a few months ago that was published from UVic, University of Victoria. And I thought it was just really cool. They found that there was like a 1 to 2% decline in thinking and memory ability if you replaced exercise with sedentary behavior. So increasing 8 minutes a day, if you increase your sedentary behavior by 8 minutes a day, there was a decline in thinking ability. So to me, I was like, oh, I'd never thought about that. I think about exercise and going outside and doing all this stuff, but I never really thought about the fact that sedentary behavior is actually an issue. It's not a neutral thing on your brain health. It's actually bad for you. So sitting in front of your couch, sitting in front of your computer, like I do every single day for hours at a time, not good for you. It's actually, it's bad for your brain. And so my take home was that my Apple Watch, which if you have an Apple Watch, you know that when it dings and tells you to stand up and walk around every hour for a minute, I used to ignore that. Now I actually try to listen to that. I try to get up and walk around. And then another paper that was published not long after that one looked at indoor versus outdoor exercise. And they found that, I think they looked at 15 minutes walking, and they found that if you walked 15 minutes outside, there was a little bit better increase in thinking ability versus if you did that same 15 minutes indoors on a track or like on a treadmill. And I thought that was really cool because I had just recently learned here in Calgary, where I've lived for a few months, that there's a community center here that's actually working to bring the outdoors indoors. And so they're creating, and it's not finished yet, but they're creating an indoor walking track with elements of the outdoors inside. And so I thought that was so amazing because I moved here in the middle of winter. I moved from Vancouver. It was minus 30 for like, I don't even know, like it never ended, right? It was so cold. And so places like Calgary, this is really important initiatives to bring the outdoors indoors. And I think it'd be really neat to see if the impact on brain health and dementia prevention in this community center, in the population that's using it, if there's any difference between whether they're using the indoor outdoor track versus going outside versus just being in a gym. I think there's a lot of interesting things. And I think it's kind of, I don't know, it was surprising to me that there is such an impact.
I love that. I feel that we notice ourselves when we do something outside versus inside. You can feel it. I can, at least if I walk or run outside versus inside. Faye, how about you? Because you found this channel, aerial for you has been the answer. I imagine that's happening inside. What do you think about where you exercise and who you're doing it with in terms of how it benefits us?
Yeah, I do aerial. It's mainly indoors, but I think a lot of our panelists have talked about this, just finding activities that you can do anywhere, whether it's walking outside. I try to incorporate a lot of movement and exercise with my mom. She's in the later stages of dementia, so her movements are not what they were. She has difficulty picking up utensils. She's in a wheelchair. But I want to make sure she still has those opportunities to go outside. And one of the things I love the most about visiting her is our walks. In the summertime, I'll put on her hat and the sunscreen on her face and we'll go for walks, and I will just talk about the neighborhood and the gardens. And I know that it's better for her and she's enjoying that. And I think those moments, they don't have to be really strenuous exercise, but those moments that I can share with her are so important to me. And that's something that I keep doing on a daily basis with her. And it's good for both of us.
Laura, Jane touched on this a little bit about the notion of facilities not really making it that easy for families to help encourage activity on an ongoing basis. And we do have a question from our audience about how we can do better and encourage our facilities to provide more exercise programs for residents. What do you think of that?
I think there's two separate and related points. I mean, I think one thing that we should recognize, but we don't recognize well enough, is that people with dementia have a right to the same supports for our health and function as every other person. And that's embedded in, the United Nations Convention on the Rights of Persons with Disability. So supports like physical activity and exercise are essential supports that people living with dementia should have access to, whether they're in the community or they're in long-term care, as the question referred to. The challenge is that people who support these programs often have no training regarding dementia. And so if you have an enthusiastic instructor, they're going to try to figure out how to accommodate their needs. But they'll have to figure it out trial and error. So they're starting from scratch each time. And if you don't, then they just might not be included at all. So I think to respect this need, physiotherapists, occupational therapists, kinesiologists, exercise physiologists, all need to have proper training regarding dementia, whether they're in the community or in long-term care. The question was really, how can we encourage it in long-term care? And one, funding, of course. There are physiotherapists and occupational therapists that are funded, but it's often around rehabilitation from a very specific condition. If you have a hip fracture, they get rehabilitation, and that's not enough. And two, it's also around the risk model too. Is, we know falls are a major indicator of quality of long-term care. And the easiest way to stop falls is to stop people from moving. And so we need to have that weigh off of people having a right to have good quality of life, to interventions that support their function and not just avoiding falls. Because I think sometimes, it's important. Falls have serious consequences, but when you're restricting people's right to move, I think that's ending up with a poor quality of life and function overall. So just thinking about our indicators, I think is important.
Thank you. Cindy, there's a lot of interest in the chat about the negative effects of being sedentary. That was a bit of an aha moment too for me when you shared that. Not only is it neutral, it's not good, right, for our brains. So it's not a question of, oh, it'd be better if I move, I'm okay if I stay right here. I think what you're seeing and what we're learning, and maybe the research will increasingly point to, is the detrimental effects of not moving on the brain. When we think of that, what do you think, what would you say to governments? What's your call to action to the provincial government of Alberta, or, across Canada, as well as the federal government? What do we need to remind our governments of when we think of all we're learning and where exercise sciences may be headed?
Well, that's a hard question, but also an easy question, because put the money where your mouths are, right? We all know the government's telling us to, take care of ourselves, our population's rapidly aging, do exercise, do 150 minutes, do this, but they're not providing the funds to individuals or researchers even. Like the amount of our budget in Canada that's dedicated to research is woefully tiny. It's compared to other countries, it's very small. And so it's all about money, right? So I would say the government, we need targeted spending on creating and subsidizing physical activity programs in our community. And I think subsidizing is a big thing that we're missing in a lot of communities. Access is hard, as everyone here has mentioned. So targeting that spending and getting it into the communities and partnering with researchers. So I think the key here will be facilitating partnerships between local governments, local organizations, and researchers to come up with evidence-based programs and recommendations for physical activity so that we can incorporate those into our long-term care facilities and into our community centers so we can help people that need the help. And also thinking about programs that we can help with caregivers of people living with dementia. That's a very underserved population. I mean, I don't know very many programs that are tailored towards helping people that are caregivers. And I think that's something that's missing. And once again, it all comes down to investment of funds from the government, I think.
Faye, as a caregiver, what's your call to action to governments?
I'd like to reiterate what Cindy has said. I have a big audacious dream, and this is what I talk to people about. I would love to see more facilities that are inclusive of families who are living with dementia, caregivers and loved ones living with dementia, because I love being able to be with my mom, and I don't want to have to try to schedule time to be physically active and then care for my mom. I want to be able to do that all together. I think it would help so much, and intervening before something becomes a crisis point with families, bringing in programs that introduce how to integrate physical activity in your life. I think that was key for me. If I hadn't found an activity I loved, I would have just tried to juggle the work, caregiving, exercise all together, and it would just be a big mess. Like some direction would be wonderful. So yeah, that would be my call to action, like more facilities, as Cindy said, more funding and more opportunities to learn and resources to learn, because I know that I should be more physical. But how do I do this?
How do I do it? And can you make it easier for me to do? Bill, how about you? What do you think governments and other leadership should do next about exercise and the brain?
What I would like to see, especially up where I am, being a rural area, there's virtually nothing outside of the towns, virtually nothing. The next township over from me, Conme, are hoping, they have been given a 150-acre piece of property, and they're hoping to establish a seniors live-in center, shall we say, with walking trails. There's creeks that run through this property, et cetera, et cetera. The big problem for that, and the big problem in Thunder Bay itself, is transportation. It's great to have these things, but if you can't get people to them, what I think is needed, there's more funding definitely required to establish and maintain these programs, but to get people to the programs.
Laura, we're hearing a lot about the kind of building of these rich partnerships and partnering with people with lived experience, including the caregiver, building programming, building facilities. No shortage of things to do to improve, but what do you think what are your priorities for government in terms of where to go next?
That is a great question. And I reiterate, of course, everyone, that funding is at the essence of all of it, unfortunately. And it's just what you fund, but we need funding from research through to programs, through to the transportation, as Bill said. When we talk about the barriers to, exercise, you can't ignore the fact that you need it all the way from the home through to the program. So that transportation issue, that having someone to support you, and often that's the caregiver or care partner, are all essential along the way. So I would say it's a hard one, but thinking about, while we develop the knowledge of exactly what we want to recommend, that implementation research that really understands how we create accessible programs in our community, which requires community partnerships, I think is an important in between that we have to recognize. Let's test and carry out those community partnered research. And it requires transportation. We know the shuttle services allow participation of people who don't have a care partner, for example, who can't, or have a care partner who works, so can't drive them all the time. I think is really important to linking what's available in evidence into practice so that our community members, whether it's the caregiver or the person living with dementia, can benefit.
Mm-hmm. Jane, before we move to our Q&A, I'd like to give you a chance to share with us what you'd like governments to prioritize.
Obviously confirming what everybody else has said, but I think one of the things that I have struggled with that I feel like gets overlooked in a lot of discussions about this is the role of regulation and standards. And I think we know that they just came out with new national long-term care standards that are focusing on quality of life and the rights of people to accept a little bit of risk in their life that people have choices and are still should be able to make choices. But what I find is a bit of a gap is where standards apply for retirement home living, which is a big sector of congregated care living that is filling sort of a niche for people with memory issues. So you'll see, at least in Ontario, more and more retirement homes offering memory care programs, etc. And so where I feel the standards are really necessary to ensure good care and great quality of life for people with dementia is looking at those particular facilities because they are private, they are not public, and so they have a different set of regulations. So I think that's what I would like to see regulators and governments and academics and researchers, I'd like them to focus on that sector, which is a rapidly growing sector. And so that would be my preference.
Mm-hmm. Thank you. We have a question from Ruth about what can you share? Maybe I'll direct this first to Laura and Cindy, but if others have anything to add. What does the research indicate about lack of exercise and cognitive decline when somebody enters a long-term care home or long-term care facility? Maybe Laura, can you start and give us a sense?
That is a good question. And I don't think I know of anything. So Cindy, maybe you can catch studies that I don't know of that look at the transition into long-term care and the lack of exercise. I know that there are exercise programs that have been evaluated in long-term care and that they carry some cognitive benefits if there's enough volume and intensity to benefit, although adherence is a challenge. While I would expect that increase in sedentary behavior would come with cognitive consequences, I don't know about specific program or studies that support that.
Cindy, anything you can add?
I agree with Laura. I don't know any. There was a paper last year that came out that looked at long-term care facilities in Ontario, actually, and they looked at cognitive decline before and after COVID. And I think they found that there was a decline, like an accelerated decline, but I don't think they never attributed it to lack of physical activity. I think that paper was looking at lack of social engagement and social isolation. So I don't know of any studies that have specifically looked at rates of cognitive decline after being in a care, while being in a care facility, and the association with lack of physical activity. I don't know, and that it would be. I mean, like Laura, I would also suspect that it's absolutely related, but I don't know I don't know anyone that's looked at that.
Yeah.
Sounds
might be a
like
grant.
sounds like we have an idea for
Yeah, grant idea right there.
Bill, I wondered if you can share your experience as somebody who stayed in your own home, still caring for your animals, you know, still very much engaged in your community. Have you had the opportunity to compare your journey with others around you who have not been able to stay in their own home, who have gone into long-term care? Have you seen any of those differences in your own life?
Definitely. Approximately 12 years ago, I was in a support group. There was 12 of us in the support group. We met weekly. This again was in conjunction with the Alzheimer's Society of Thunder Bay, but we met weekly. Of the group of 12 of us, I'm the only one still alive. And I'm the only one who on a daily basis had something physical to do. The rest of them quite literally bought into being told or going along with the stigma, shall we say, that you are no longer capable of doing this. And most of them, again, other than the meetings we attended, sat at home in a room, watched TV, or stared at a wall. And I know that for a fact. A recent group that I've gotten involved with through Dementia Cafe here in Thunder Bay, same thing. There's been a rapid decline in people, and a great number of them have died in the last 2 to 3 years. And it's the same problem. They simply do not get out, and they have nothing to do. Nothing to do.
Faye and Jane, I see you nodding, both of you. This is resonating. And I know it speaks to your own recommendations and calls to action to government about where to invest. Faye, it sounds like you're carving out these moments with your mom to still be active as much as you can. Is there any advice that you have for other people who might be in your position about how to build activity into those visits, even when, of course, the mobility is so reduced?
Yes, I don't know if I have advice. I'm just sometimes going about it and seeing what works. And I think going into those visits with that mindset, like, I'm going to try this out and maybe it'll work today, maybe it won't. But I spend a lot of time just sort of observing what my mom does naturally, like without prompting or without guidance. I know that she likes to, I find her tracing things on her table, or tracing the pattern on her clothing. And so I try and pick up on that. So I've gotten her a fidget blanket with a lot of different textures. We have different types of materials, and we create these different designs with various games. So I think it's really looking for opportunities and not setting a hard and fast expectation, like I expect to do like 20 arm raises today or else I'm a failure. It's kind of being flexible, looking at the moment. If it's a beautiful day, then go outside. If it's not, then walk around the home or find something inside that is creative but keeps that movement alive. It's at this stage, I feel like it's less about physical exercise and more about movement, and trying to retain those movements and get some of that muscle memory of like holding a pen or holding a spoon. And for me, that's a win when that happens.
Mm-hmm. Jane, you experienced a bit of that muscle memory with your dad, I think, right? As an avid golfer, I think you were able to see, even if he had lost some ability in some areas, was he able to swing a club if you took him to the driving range, or what was that like?
Yeah, my dad was able to keep golfing until he was 89. And we, that was a community effort to keep him going. He had a group of friends who he had golfed with for 50 years kind of thing, and they essentially picked him up every golf day and kept him going. And when that was no longer possible, we filled the gap, and so we started taking my dad. And I just found the getting him back into his familiar setting where he knew he could still tell you where he needed to hit a golf ball and what club he would need. And this would follow, a very confused moment. And then all of a sudden you'd put him back on the golf course and he'd be able to swing the club and walk to the next hole, and just sort of re-engage completely. And then that would make him feel better, make me feel better. He'd go back and he'd be more cognitively aware, more alert, and just happier that he was able to go back and do something that was really familiar to him. Now, obviously, the pandemic just shut that down, so we weren't able to carry on with that. But he was mobile until his final days. He was still walking, and in large part, that's because we kept him moving and kept getting him up and taking him places and going outside and keeping him moving. So I'm a strong advocate. And music, by the way, huge. When we couldn't go outside, we'd put on some music and my father would jump out of his chair and start dancing with me. So that was wonderful.
We're coming close to the end of our session. Just a reminder that if you do ask a question and we aren't able to address it live, the Dementia Talks Canada team will follow up by email. Please include your name. I'd like to give everyone a chance to just have, closing thought. Laura, I'd like to start with you.
Oh, that's a hard one. I would just like to advocate to everyone on the line that, be active in whatever way possible, and don't be afraid to self-advocate to your community programs. Just because something doesn't explicitly say that it's for people living with dementia, it doesn't mean that there aren't ways to include them. There's training available now for exercise providers to support them. And so hopefully we get more and more that are trained to support and include people living with dementia. For all the reasons attached, I think the social benefits, the music that's often part of programs, the learning new things, I think it can be this multidimensional, program that really improves the person's well-being.
Cindy, anything that you can leave us with?
Oh, I just wanted to thank everyone for this opportunity. It was amazing just to hear everyone different perspectives. And I mean, so many ideas have already come up, like just through our talking, for new ideas for studies, and to hear what's missing out there in terms of knowledge translation has been really eye-opening. So I just wanted to thank everyone for sharing the questions in the chat. And I saw there's tons of different links being shared. So this was really, really great.
Thank you so much. And Jane, do you have any closing thoughts for us? And can people reach out to you if they'd like to connect with you through Alzheimer's Society to maybe ask a question directly? Yeah.
Yeah, absolutely. And yeah, I am just aware through this talk how long I've been sitting.
I know.
I want to get up. See you guys.
Absolutely. It's so true. I found in preparing for this talk, it motivated me to get out from behind the computer every day, because you can't have these conversations and not move around. You really start feeling it and noticing it. Faye, how about you? Anything you'd like to share? Any advice that you'd give to a friend, let's say? I know you mentioned that you wished you had connected with your local Alzheimer's Society a little bit earlier.
Yeah, absolutely. I wish I had sought out resources a lot easier, or a lot sooner. It would have made everything so much easier. And I know a lot of caregivers in my situation who are still raising children and taking care of elderly parents. But for me, movement was so, so important. And for so many years, I felt really powerless in terms of addressing dementia. There was nothing I could do to stop the progression. And you get really mired in that mindset. And physical activity gave me back that sense of control. Like I could do something, I could bring little movements and activity to my mom by being better knowledgeable, and it made me stronger, it made me a better caregiver.
Mhm. Bill, maybe you can leave us just with a little bit of something to inspire us. Like, what do you have planned for this afternoon? Something tells me you are going to get up when this
Well, as a matter of fact, I plan to take Buddy, my dog, and we're planning to take chainsaw, go back down to the beaver pond. And as you know, I contract with Beaver Timber and Logging. They knock down the trees, they eat the leaves, they eat the branches, and they leave me the trunks. So I've got a lot of firewood to cut up this afternoon.
Awesome. Thank you. Thank you, Bill. Thank you, everybody, for joining us. And thanks to our panelists for this really wonderful discussion. Next month, join us for our special Alzheimer's Society event, which we will discuss animal therapy. So service dogs, pets, and dementia care. Might have to have you back, Bill, I guess.
Love to.
The next Dementia Talks is August 10th at 12 Eastern. You can find out more at alzheimers.ca / August Talk. So the recording of this session will be posted on the Alzheimer's Society of Canada's YouTube channel in the coming days. You will receive an email notification when it's posted. Thank you very much. Please take a minute if you can to just complete this poll. We really appreciate your feedback. News about Dementia Talks is also part of Brain Canada's monthly newsletter, Brain News. So if you don't subscribe, please do go to our website and you can subscribe to Brain News and stay up to date. So any feedback or questions can be sent to publications@alzheimers.ca. Thanks again for joining everybody, and have a wonderful active afternoon.